We are here to talk about what is palliative care. And let me start with what is not palliative care. Palliative care is not just about end of life, it is much more. Some of us might have thought palliative care is equal to end of life. No. It is a multidisciplinary line which focuses on prevention and support to the patient and the relatives when they are suffering from serious or sometimes life-threatening disease. It is not about just end of life.
Setting here. So what's happening is that, with medicine advancing in so many ways, life expectancy is increasing, lots of therapies are available, even if you take cancers, a lot of medical treatments. So we are able to keep people alive for longer, right? But what is also happening is that there is so much more that needs to be done beyond the doctor's clinic where the medicines are given. Because when people live longer, their quality of life becomes very important. And earlier, we did all this because we had extended families, the aunt would help, the cousin would help, come and spend some time. If there's a need, we would immediately reach out, and there was the grandmother's experience, and it all worked like that. But we are now all getting into nuclear families, everybody is busy, and this comfort that the patient needs beyond the medications is something we all struggle with. Even if I'm a doctor, I'm at my workplace and there's something happening in my home, and I'm not able to address that need. So it's not that this is not felt anywhere over the world, that there is a lot of it that needs to be done beyond just the doctor's help. And when we start exploring, it's much, much bigger than just this comfort. And that is why this whole area of what is called palliative care medicine, it involves many more things than this. And there are now experts, and there have been some path-breaking, pioneering people, and one of them is Rajam, because they realized as doctors when they were giving care that we need to create a whole space for this, and that's how it got called palliative care. In medical circles, palliative has this feeling like, kuch nahi kar sakte. So when people hear this, they don't like it. They go and take one more opinion. They don't take one more opinion. But you can actively take care of people without having to just give them medicine. So this is the area, and I'm going to let Dr. Rajam speak about it. She has a great experience. She's been a pulmonologist, and then halfway through her career, she has worked at Bhatia. She's still at Hinduja and Bhatia. Then she realized, and she went and trained in palliative care, first in India and then abroad. She's also worked abroad in this field, and she brings all her experience, and she's been one of the pioneers pushing for palliative care and how end-of-life care needs to be handled in our country, how we need to give dignity to people who are getting older, and how we need to respect their wishes. So there's so much to it. So I'm going to let her come and speak, and I'm so happy you agreed so promptly, Raja. Thanks a lot. And
so today India is so high on medical tourism. People come to India for state of art. There is nothing lacking in India. So if you really want to have the best treatment in cardiology, best in neurology, best in pulmonology, it's all here. What we are forgetting in the process is that we are health care professionals. We are focusing so much on health cure that we completely forget about the care perspective, correct? And what happens is, if you sit back and think, and I'm sure Dr. Jayanti will agree, of all the conditions that we see, we cure only 1/3. Because those are mainly infections, which again, COVID taught us a lesson that we couldn't even cure COVID. Infections are the one where we help treat patients and let them bounce back to normal. If you see conditions like diabetes, lung disease like COPD, asthma, lipids, hypertension, we only control it, we can't cure it, right? And then there are 1/3 of the conditions which are incurable, like she will agree to Parkinson's, motor neuron disease, maybe interstitial lung disease, cirrhosis of the liver, CKD, like chronic kidney disease. Unless you transplant a kidney or transplant a liver, there is no cure. So actually we doctors call ourselves saviors for only 1/3 of the conditions. What do we do to the other 2/3? We only handhold. And what is handholding? It is palliative care. And people don't like the word palliative care because it gives a negative connotation that I'm going to die. Because historically, palliative care was started for patients dying with advanced cancer. So even today, many people ask me, are you looking after only cancer patients? So it's not just only cancer patients need handholding. Any chronic illness, any serious illness needs handholding. And that's where the role of palliative care comes. And the whole point is, yes, I and my colleagues are not able to change the end point, but the journey is made more bearable. We need to support each other. Like I always say, the one learning lesson from COVID is to be fiercely kind. You be there for the human being. You might not be able to offer solutions, but listen to his issues. Acknowledge the distress. Ask how I can help you, and just be there for the human being. It makes a huge difference. You can't change the dementia, you can't change the Parkinson's. But even if you offer to take the mother or father for a stroll in the garden or bring some idlis in the afternoon, it's a huge deal, and it's not that you're doing anything extra. It's a small gesture that makes a difference.